Welcome everyone to today's convening on artificial intelligence for state capacity. It's a privilege to open this important conversation, and on behalf of Artha Global, Dalberg, and Project Tech4Dev, we thank everyone who has joined us today. We have a distinguished group from government, technology, philanthropy, and academia, and with over 500 signups and close to 200 people having already joined us, and many more folks joining us every minute. Uh, as we kick off this conversation, I'll begin with a brief note about Artha. Artha Global is the policy consulting organization that partners with governments, multilateral agencies, philanthropies, and the private sector to address systemic challenges to shared prosperity and opportunity. Although our primary focus is India, we also work globally to provide actionable research and solutions, support policy implementation, and build capacity. Developing countries are undergoing critical transformations as they urbanize, digitize, and formalize. We help address these complex challenges at their roots through our 4 centers that focus on building healthy and productive cities, on harnessing technology for better societal outcomes, on producing faster frequency data, and on delivering inclusive economic growth. Through our Center for Technology and Innovation, we work with governments on topics ranging from digital competition and data protection to artificial intelligence and digital public infrastructure, providing support through advisory, pilots, evaluations, and capacity building. Most recently, we launched the DPI Academy to help build strategic capacity for policymakers, and we support UNDP as a knowledge partner for the UN DPI Safeguards Initiative. Today's discussion, co-hosted by Artha Global, Dalberg, and Project Tech4Dev, envisioned as part of a series of conversations, will explore a range of questions about artificial intelligence and state capacity, the capabilities of the technology, where and how it can be deployed in a responsible manner for better outcomes, and why it is important for all stakeholders to contribute to this process. India's developmental achievements in recent decades are remarkable, especially given our nation's scale and diversity. Yet the Indian state sometimes still grapples with fundamental challenges in governance and last mile delivery. The structural hurdles include the fact that India has just 1.4 government employees per 100 people, about 1/5 the per capita staffing of the United States. Chronic understaffing and limited investment in training sap the capacity of our frontline officials. The current AI movement in the global context revolves around a few ideas. Countries dealing with concerns around sovereignty and governance of AI, the productivity and disruptive shifts that AI can enable for private enterprises, and the risks that artificial intelligence can introduce or worsen around the world. What AI can do to enhance state capacity is of as much, if not more, relevance, especially for us from a developing economy perspective, and is largely missing from the conversation. AI offers building blocks with diverse capabilities, each with its own level of reliability and maturity, which determines how and where they can be applied effectively. I believe we're still in the very early days of experiencing and learning what the current generation of AI advancements can unlock for growth and prosperity, while behind the scenes, the less talked about and almost unglamorous advances and applications that use artificial intelligence are becoming trusted and integrated into everyday workflows. One immediate promise is in automating repetitive low-value tasks to support frontline workers and help citizens, making government more accessible and responsive. How the state prepares for its adoption and how it can handle the slew of novel advancements appearing almost on a weekly basis will be something that our speakers and panelists will touch upon today. While we examine this topic from the perspective of the government, where it could include broader institutional reforms such as the investments in people, robust processes, and strong accountability mechanisms, another aspect that we definitely want to focus on today is the complex nature of collaboration between different stakeholders in AI deployment, why it is important, and how it can contribute to better outcomes to bolster state capacity. And today's agenda reflects this ambition. We begin with lightning talks from practitioners who are already deploying AI in collaboration with public authorities around the country and will share their experiences to ground our discussion in real-world challenges and innovations. Our panel that follows these practitioners brings together a wealth of expertise, the global perspective on technology and geopolitics, pioneering work in healthcare AI, digital transformation leadership from international development, shaping responsible AI policy, and decades of experience in public policy and financial sector reform, among many other perspectives. And together we'll explore a few pressing questions, including Where do we think AI can make the greatest difference in state capacity, and where is human judgment irreplaceable? What does effective human AI collaboration look like in government? The infrastructure, data, and policy frameworks that are essential for success, balancing rapid innovation with the need for safeguards and accountability. And crucially, what is our vision for the future? How can AI help build a state that is not just more efficient, but also equitable, inclusive, and responsive to every citizen? To start us off, I'd like to introduce Mr. Abhishek Singh, our keynote speaker, who has been at the forefront of many efforts in India to strengthen the state capacity for AI. Mr. Abhishek Singh was able to kindly make some time during his Internet Governance Forum commitments in Norway. And although he couldn't join us directly, he shared a few remarks earlier today for our convening, which we will play out. Mr. Abhishek Singh is an officer of the 1995 batch of IAS with diverse experience in administration, managing law and order, implementing development programs, and policy formulation at the Union government for use of technology in improving governance. He is presently Additional Secretary, Ministry of Information, Technology and Electronics, Government of India, with the responsibilities of artificial intelligence and emerging technologies, cybersecurity, and digital skilling. He has previously served as CEO Karmayogi Bharat in the Department of Personnel and Training and CEO of the National E-Governance Division, Digital India Corporation at the Ministry of Electronics, Information Technology, Government of India.
Good evening. It's truly a privilege to join you today for this very important conversation on how artificial intelligence can be harnessed to enhance state capacity. As someone who has spent years working closely with digital transformation in governance, I believe this conversation couldn't be more timely or more necessary. We often talk about the promise of AI in the context of economic growth, personalized services, or revolutionary products, but rarely do we stop to ask how can AI serve the state not just as a tool for innovation but as an enabler of better governance, of better service delivery, and ultimately of a better social contract between the government and its citizens. Let me start with a fundamental truth. Government servants are overburdened. Whether it's the teacher in a rural school maintaining 30 registers, the revenue officer trying to manage hundreds of files, or the police constable on a 14-hour shift, their time is consumed by routine, repetitive tasks. These are the invisible burdens of the Indian state. They exhaust our human resources and crowd out the space for empathy, creativity, and meaningful citizen engagement. This is where AI can be transformative. It is not about replacing humans, but about empowering them. It's about shifting the balance, letting machines handle the mundane so that human beings can focus on the meaningful. Imagine a teacher who no longer spends hours filling forms, but instead uses a simple AI dashboard that auto generates compliance reports from attendance data and classroom interactions. Imagine a block level officer who doesn't need to dig through hundreds of PDFs to prepare for a review meeting because an AI tool summarizes the key insights in seconds. Or think of a clerk who, instead of spending hours scheduling meetings and sending follow ups, is assisted by an AI assistant that takes care of routine coordination. These aren't distant fantasies, they are entirely feasible with today's technology. One of the most exciting areas is the use of chatbots in public service delivery. Across the country, we are already seeing prototypes and pilots, AI powered chatbots offering agricultural advisories to farmers, helping citizens navigate government schemes, or answering basic health related queries. When trained in local languages and integrated with real time data, these bots can drastically improve last mile service delivery. They don't just provide answers, they democratize access to information. We are already seeing the Bhashini project enable such transformative initiatives, such transformative projects. In fact, even in the Supreme Court, the AI agents are being used to summarize court cases, to bring in relevant information that may expedite disposal of judicial cases. Another promising frontier is training. AI can power personalized learning journeys for government officials. Instead of generic one size fits all training sessions, officials can now receive role specific adaptive training based on their location, experience, and skill gaps. Think of a sanitation inspector in an urban ward receiving targeted learning modules on waste management, innovations, or a rural development officer gaining just in time training on digital payments or GIS based planning. This is how we scale capacity building without overwhelming existing structures. Let me address a critical but often overlooked aspect: productivity. Much of the work that occupies government officials is clerical in nature. Minutes of many meetings, compliance reporting, file movement, tracking. AI tools that can transcribe meetings, generate summaries, flag action items, or track follow ups can dramatically improve productivity. They help us reclaim time, which is the most precious commodity in government work. And this is where national initiatives like the India AI Mission can play a pivotal role. As a comprehensive strategy to advance AI across sectors, the India AI Mission offers the institutional framework, technical backbone, and ecosystem partnerships required to scale AI responsibly across government. It enables access to compute, datasets, and foundational models tailored to India's needs, tools that can be leveraged to build applications specifically for public sector use cases. It creates an opportunity for ministries and departments to embed AI into their workflows, not as an afterthought, but as part of a planned mission mode approach. One example of this is the integration of speech to text Bhashini APIs into the e-office module. Today, instead of typing out long file notes, one can give a dictation in English, Hindi, or a language of one's choice and create a note sheet on the e-office by voice commands. This takes away a lot of drudgery required in typing out long note sheets. With regard to skilling and capacity building, the iGot Karabyogi platform, which offers ready infrastructure for training government servants in emerging technologies, including AI, can play a big role. Millions of users are already onboarded on this platform. It can serve as a national channel for equipping officials with knowledge and skills needed to understand and responsibly deploy AI solutions. It can also evolve into a repository of best practices and use cases, making successful AI deployments visible and replicable across the country. In fact, the iGot Karabyogi platform has also deployed AI in which kind of looks into the profile of the government servants, their competencies required for the roles that they are working on, their interest areas, and then recommends courses for the officials to do by using a very simple AI engine. While a lot of initiatives are being taken up by Karam Yogi Bharat and India AI Mission, what we also need to do is work on building capacity of government officials in being able to use technology rather than we investing just in technology. The bottleneck today is not lack of tools but lack of readiness. We need to government servants to not only use AI but to understand it, to know what it can and cannot do, when to rely on it and when to override it. This requires a cultural shift and not just a technical upgrade. At the same time, we must be mindful of the risks that are there. AI must not become a black box that replaces human discretion, nor should it widen existing inequities by excluding those who are less digitally literate. That is why human in the loop systems are essential, where AI assists but does not decide, where the human being retains agency. There is also a design challenge. Too often, digital tools in the government have prioritized control and compliance over usability and experience. AI solutions must reverse that logic. That must be built with empathy, with the frontline worker and the citizen in mind. We must ask, is this tool easy to use? Is it inclusive? Does it reduce burden or add to it? We also need to institutionalize these innovations. Many promising AI use cases remain stuck as pilots. To truly scale, we need clear policy frameworks, procurement systems that support innovation, and leadership that is willing to take calculated risks. We must move from proof of concept to institutional adoption. Let me end by saying this: artificial intelligence is not a silver bullet. It will not fill vacancies or fix broken institutions or substitute decision making. It can make the lives of government servants definitely better. It can make the state more responsive, more humane, and more capable. And that is no small thing. The purpose of today's interaction is not just to showcase what AI can do, but to reimagine what the state can become. A state where technology doesn't just automate but elevates. A state that respects its citizens' time and its own. Thank you, and I look forward to a day of rich discussions and collaborations. And I am sure the panel that we have with the distinguished speakers will come out with the action items that we can work together for implementing in the days to come. Thank you.
I'd like to thank Mr. Abhishek Singh for his inputs and setting the tone for the discussion today. I'd like to now invite Erica Arya, India Head of Project Tech4Dev, to take us through the lightning talks.
I'm Erica, and I head Project Tech4Dev. At Tech4Dev, our mission is to empower nonprofits in developing countries to use technology and data more effectively so that they can scale their programs and deepen their impact. We do this through our open source tech platforms and dedicated tech advisory support. Over the past year, we have been working closely with the NGO partners to develop real-world AI-based solutions. And today, we are excited to share real-life stories of AI being used in the field. We have 2 lightning talks lined up, each giving you a quick look into how AI is already being used in the field to solve tough problems and improve the efficiency of public systems. Talk by Vedis Foundation. Unfortunately, Vishali, the CEO of the organization who had to present this talk, was called for an urgent government meeting and hence could not join us today. So today's talk will be presented by Rajshri. Rajshri is the product manager at Vedis Foundation, where she works on the state rural livelihood missions. She is a Young India Fellow, and she combines field immersion with strategic research to enhance policy systems. Vedis has been working closely with the government of Haryana and Himachal Pradesh, and today we will learn about an exciting solution they've built, a conversational AI-based chatbot designed to make it easier for government officials and community to access and understand state government policies. Over to you, Rajshri.
Thank you so much, Erica, for a lovely introduction. Good evening, everyone. Hope everyone is doing well. I'll just share my presentation and let me know if it's visible. I hope this is visible to everyone.
Yes.
Thank you. The capacity of the state is highly constrained due to lack of access to information and knowledge, and this information and knowledge is only increasing day by day. And it's getting really difficult to stay at the top of it. During the initial need identification done by the government, enabled by us, we realized that officials and community members often face delays, confusion, or bottlenecks in accessing accurate, updated policy information, affecting service delivery. To overcome such a challenge, we created Kunji. Kunji is an AI-enabled chatbot on WhatsApp to strengthen governance by enhancing accessibility to information. Kunji simply does 2 things. One, it simplifies access to information, and secondly, it provides real-time communication tool to officials. I'll just present a short demo video to understand the product better. So that's Kunji for us. As you can see, Kunji goes beyond being a robotic chatbot and answers questions in a human-like fashion, where a user can build upon the questions they have asked. It not only does text-to-text messaging, but also allows voice-to-text input and text-to-voice feature as well. It can answer queries not just in English, but also in Hindi and English. Going beyond providing specific answers to queries, it can summarize any policy document. Going beyond, it can also provide links to the document, giving the right of choice to the user to read that document if they want. At the back end, it has a dashboard for metrics to understand the usability of Kunji and how the users are actually leveraging it. It can upload new policy document and at the same time send nudges for each new policy document that is uploaded. Overall, Kunji is an open access tool, a digital public good. Kunji, therefore, for officials, saves time, reduces dependency on state-level information sharing, and improves decision-making. For communities, it empowers SHGUMN with instant, accurate, voice-enabled support. For government officials, it enables data-driven capacity building and training needs assessment. Kunji, since inception, has been a product where the government has been the enabler of success. Developed hand in hand with the government of Himachal Pradesh, we have done 9+ rigorous rounds of testing with 50+ officials at the district block and the state level. After a year-long thought, discussion, creation, we have already launched the product in one state and another state is in pipeline to be launched by the minister. For the post-launch, salience at the highest level. Institutionalization, to ensure institutionalization and allow sustainability, the government is in process to integrate Kunji on their server right now. As part of the whole embedding process, the government has adopted a bottom-up approach and a top-down approach, a 5-point field strategy to bring systemic impact via Kunji, including notifying officials with the Kunji QR code and phone number to make the product a part of officials' daily lives, nominating Kunji ambassadors for every cluster level federation for the community members. QR code has been institutionalized in all the CLFs as well as government offices. Not only this, Kunji has now become part of all the CLF agenda, making sure that before every meeting, Kunji is being used to get the queries answered. Therefore, Kunji shows how AI can strengthen state capacity, not just by automating tasks, but by putting actionable knowledge directly in the hands of those who need it the most. Thank you so much, Anika. I think that's my time.
Thanks, Rajshri. I would just want to tell the participants and the audience that in case you have any questions, please put them in the chat box. Rajshri, there is one question in the chat which says, and either you or Gautam could take it, that the consent option in the conversational AI that is presented seems to be an all or nothing option. So is that correct? And would also want to know if there is any flexibility in this consent option. For example, the user needs more information before providing consent. So Sarda, I think I read your question correctly, but if you want to unmute and want to add anything to it, please feel free to do so. Or else Rajshri or Gautam, you can take up this question, please.
So I think Gautam, you can add, but with regard to consent.
Go ahead.
Yes. Yeah. With regard to consent, I can answer that part. We like in any other case of a tech product or like that of an app, before a user registers, they do get a proper message where they're informed about basic information regarding how their phone number will be used, etc. So the consent is taken before the registration happens. So I think Gautam, if you want to add something, yeah.
So, we have, so the basic question is, can the user ask for more information? Yes, there is a document which explains what they're consenting for and what their rights are. For example, how they can get their data deleted by raising a request. At this point, since this was a demo, we kept the demo consent video extremely simple. But you have the ability to stagger it as and how you wish.
Okay. Another question in the Q&A chat box is Kunji available only in India, or it can be accessed in other countries as well?
So Kunji is a digital public good, so it's an open access tool. Currently, we are working with State Rural Livelihood Mission, so currently with the government of Himachal Pradesh and Haryana. It is available though as an open access code, so any organization or government can use it, yes.
Thanks. Rajshri, can you also talk a little bit about, the potential scale and outreach plans for Kunji?
So currently we have already launched the product in one state, and it has more than 1,200 users on the bot who have since 9 weeks of the launch have asked more than 4,000 questions. For each of we have tried and we are experimenting with the product and seeing how chatbot can create impact. So the target users, at least for State Rural Livelihood Mission, has been about 1,200 plus community level federation members, plus the state officials, state, district, block, and below officials, which are about 350 of them. So it is a replicable product, having been launched in Haryana with the government. We have reached about 1,500 users. The target is of 1,500 users, and the plan is to take it forward to Himachal Pradesh as well, where the launch is to happen soon.
Thanks. And a couple of people wanted to know, how do they access Kunji? Is there a WhatsApp number which can be shared? And is it open for anyone to interact with the bot?
Yeah, there's a WhatsApp number which can be shared. There's a QR code as well. And yes, everybody can demo it.
So maybe you could share it in the chat box later. Okay, so
yeah.
People. Cool. Thanks. So maybe Gautam and Rajshri, you could answer the questions in the chat window. So now moving to our next lightning talk. This is being presented by Amrita Mahale, who is the Director, Product and Innovation at Arman. Amrita leads the development of human-centered, data-driven, and AI-powered solutions to improve maternal and child health across India. With over 7 years of experience in digital innovation and AI product strategy in the social sector, Amrita has played a crucial role in scaling some of the world's largest health programs, including Kilkari and Mobile Academy, reaching millions of women and frontline health workers. Welcome, Amrita, and it's over to you.
Thank you, Erica. Good evening, everyone. My screen should be visible. Can you see my presentation? Yeah. I'll quickly tell everybody what Arman does. Arman is a nonprofit that works in maternal and child health with a focus on preventive care. And we run large-scale tech-based programs that fall into one of two categories. So one category of programs is targeted at new and expecting mothers, where we empower them with preventive care information to encourage health-seeking behavior. And the second category of programs is focused on health workers. So these programs train and support health workers to provide better quality of care. We run multiple programs with different government bodies. So we work with the Ministry of Health at the national level. We work with state governments. We work with municipal corporations as well. And our programs have reached over 60 million women and children. And we've trained over 500,000 health workers. So Arman has been designing and deploying AI solutions for several years now. So while I'm going to focus on one of our projects today, the learnings I'll share are derived from a variety of different solutions that we've built over the last 3 to 4 years. So one category of solutions is more, old-fashioned classical machine learning to predict user behavior. So we have programs where we predict which users are likely to stop engaging with our programs, so we can target them with the appropriate intervention to improve program engagement. We also have AI solutions that are focused more on optimal allocation of limited resources. So for example, for our National Maternal Messaging Program, Kilkari. We use AI to predict the best time slot to call a woman. The program has over 10 million active subscribers in 27 states. So we use AI to predict the best time slot to call a woman to maximize overall listenership. And more recently, we've also been experimenting with generative AI, and we have chatbots for both health workers as well as women and their families. So the chatbot project I'm going to talk about today is focused on high-risk pregnancy. So let me just summarize the problem we are trying to tackle through this digital solution. So a woman dies in childbirth every 20 minutes in India, and for every woman who dies, 20 more suffer lifelong complications. And about 20 to 30% of pregnancies can be classified as high risk, but they account for over 70% of deaths and complications. So if you could actually focus on managing high risk pregnancies better, you could reduce preventable maternal deaths by a large margin. And one of the reasons why these preventable deaths persist is because of the poor early identification and management of high-risk pregnancies by frontline health workers. And I think this is a theme that's come up repeatedly this evening. Frontline health workers are overworked, undertrained, and they lack access to ongoing learning and support. This is where our high-risk pregnancy program comes in. So as part of this program, which is currently live in 3 states, we've developed very detailed protocols for what needs to be done by different cadres of health workers to detect and manage high-risk pregnancies. And it's a hybrid model, so there's classroom training and digital learning and support. And there's also a tracking piece and data-driven advocacy piece. But if you talk about, for me to talk about just the chatbot piece, let's zero in on a few details. Frontline health workers lack access to ongoing learning and support opportunities. And we had a WhatsApp support helpline, which health workers were already using as part of the program to ask any doubts they had while they applied what they'd learned in the classroom in the field. So we saw this as an opportunity to try out using generative AI. So we've built a multilingual, multimodal chatbot that can answer frontline worker questions about antenatal care and about high-risk pregnancies. The chatbot supports both voice and text-based queries. And this is the workflow. So the cadre of health worker we focus on here is the A&M, auxiliary nurse midwife. And there's an A&M for a population of 3,000 to 5,000. She's the lowest level of frontline health worker at the community primary level. So the A&M can send, learning queries, support queries through the WhatsApp helpline. And the chatbot generates instant answers for a majority of A&M queries, but there is a human in the loop who answers questions that the LLM cannot answer in a satisfactory manner. So here's an overview of the chatbot. We don't have time for a demo. We start off with a digital onboarding experience where we send a multimedia tutorial to all users with step-by-step instructions and safety reminders that this is an automated service. And when in doubt, they should consult their supervisor or medical officer. The answers are drawn from the training protocols, not from the internet. So this is all clinically validated information. If the chatbot does not find an answer in the training protocols, these questions get escalated to a human in the loop. There is a feedback prompt after every answer. And if the user is not satisfied with the answer, those questions also get escalated to a human in the loop. So I want to spend a minute or two talking about the overall project journey. So it's taken us over a year to build and deploy this. And we spent a lot of time understanding the right use case for this chatbot. And early on, through research with both A&Ms as well as other stakeholders, we learned that learning support was a better and safer use case than decision support. We also spent a lot of time curating and creating the right knowledge and evaluation data sets for the chatbot. Before we wrote a single line of code, we actually used a prototyping method called Wizard of Oz testing to understand how a chatbot like this will be used, interpreted, perceived on the ground, and to understand user behavior. We have an in-house team of gynecologists and other clinical experts. So the chatbot went through several rounds of lab evaluation before it was put in the hand of real users. We first did some small-scale, face-to-face user testing, after which we did a pilot with about 100 ANMs for 3 months. And in the pilot period, we were essentially getting all answers validated by a clinical expert. And from 100 users in a 3-month period, we got about 1,000 queries. About 70% of them were answered by the chatbot, the remaining by the human in the loop. The medical experts rated 91% of the answers as satisfactory, and user feedback was 94% positive. And then when we looked at the 9% of questions that were rated as non-satisfactory, we made sure that none of the answers were harmful. The answers were not satisfactory because they were irrelevant. They were not actually medically inaccurate and could not have caused harm if followed. So after this pilot, we scaled the chatbot to 3 districts in UP. And we are now doing evaluations in Telugu as well. And our program is live in all 33 districts in Telangana. So starting next month, the chatbot will be deployed in Telangana as well. So what next for the chatbot? We want to take it from being just a chatbot to a learning and support co-pilot, which means it will work in both push and pull mode. The pull mode is also currently activated. That's what it is, where the ANM asks a question and then she gets a response. Push mode is where we send her bite-sized lessons, and then she could follow up with any questions she has. And each time she asks a question and gets a response, the chatbot will also suggest follow-up questions, which will help her continue her learning journey. So just to wrap up, I wanted to share some general principles that we at Arman follow for all AI projects. The first one is to pick problems rooted in user and program needs. So don't start with AI, start with a deeper understanding of the problem you're trying to solve and whether AI is the appropriate technology to address the solution. So for this particular project, this meant that we picked, a learning support use case over decision support because that is what the program and the user needed. The second step is designing for inclusivity. And, we follow a human-centered design process. I talked about some of the prototyping and testing we did with users before we launched the chatbot. But one very concrete way in which this influenced the design of the chatbot is we saw that a lot of the ANMs, especially the older ANMs, were not comfortable typing long questions. So this meant that we had to prioritize voice on day one, which delayed our launch by a few months, but we had to make sure that we supported voice queries and voice output as well. The third one is data privacy and security. We have very strict data handling policies. We work with collaborators. We make sure no PII is shared with collaborators. The importance of interdisciplinary teams and a commitment to ethical R&D. So we work with collaborators on all our AI projects. We don't have an in-house AI team. We work with ArtPark on this particular project. We work with Google DeepMind on a few other projects. So Arman brings the program expertise, a deep understanding of the user and the problem context, and the partner brings in the AI machine learning expertise. And the last one is about following an iterative approach. So moving slowly, building deliberately is very core to how we operate at Arman. And we always start with small studies and pilots before we ramp up. And this is a principle we followed quite closely even in this particular program. So I'll stop here. I'm happy to take any questions.
Thank you, Amrita. We will actually take questions in the chat if that's okay, because we are just running a little short.
Sure.
So thanks for that presentation, very informative. So please type in your questions in the chat, and Amrita can try and answer those. Good evening, everyone. I'm Kunal Walia. I'm a partner with Dalberg, and my pleasure to introduce the panel discussion that's going to follow now. Super excited about that. I lead Dalberg's digital and data practice globally. For those of you who might not be aware, Dalberg is a social impact focused strategy consulting firm. For over 20 plus years, we've been working to solve some of the most challenging problems, ranging from governance, public service delivery to climate change, health and education. Our technology team really looks at how can tech be used to enable the impact across these sectors, but also how technology should not be used, and what is the safest and the most inclusive way of using technology. So that's a little bit about Dalberg. Now we've heard from Mr. Abhishek Singh and these two lightning talks, which were quite impactful. Kunji and Arman, about how AI can be transformative in governance and public service delivery. Mr. Abhishek Singh spoke about this broadly, but I would say that there are probably three categories here. One is productivity enhancement, automation of tasks, which takes a lot of time for last mile workers. The other one is AI can be used for capacity building through personalized micro trainings, which we've seen a lot of. And then better service delivery, enhancing and building capacity of last mile workers, leveraging videos, leveraging local language delivery, using generative AI. Really three categories. And we're seeing these examples pop up across countries similar to India. One of the most impactful ones is AI being used to strengthen public procurement, which has always been a challenge for governments and for ministries in countries like Indonesia and in Brazil, to review proposals, to identify leakages and that sort of thing. So the question is not about whether AI can be used to enhance capacity or what can be done. It's really about how. And the panel will talk about this now, and the panel will talk about three things. Really about how capacity or training should be built of public officials who are already, quite have limited capacity. They have a lot to do, and can AI actually be used to train them? How can they learn how to leverage AI in the most productive manner? The second most important, and Amrita spoke about this a little bit, is what are the policy frameworks? What are the responsible AI frameworks? How not to use AI? How to use it in a equitable manner for policy building? And the third would be, how can we continue to promote the infrastructure needs that are required to leverage AI? And that also goes into data sharing and interoperability across ministries and things like that, right? So the panel will go deeper into these topics. Without further ado, I'll introduce Anirudh, who will be, moderating the panel. Thanks, Anirudh, for doing this. So Anirudh Suri is the Managing Director of the India Internet Fund, a technology-focused venture capital fund with operations in India and the US, and a non-resident scholar at Carnegie India. Anirudh is also the author of The Great Tech Game, Shaping Geopolitics and Destinies of Nations, and also hosts the Great Tech Game podcast. A seasoned entrepreneur, policy advisor, and author, Anirudh brings a global perspective shaped by leadership roles in McKinsey, Goldman Sachs, and the Government of India. Couldn't think of anybody more equipped to take this panel and moderate this. With that, over to you, Anirudh.
Thanks so much, Kunal, for that kind introduction as well. It's my honor today to be moderating the panel discussion. I think we have about 45 minutes for this discussion. So we'll try and, much like the lightning talks, try and cover as much ground as we can over the next 40 minutes. I'll quickly mention one-line bios of the panelists we have, so that we can retain much of the time for our conversation. I think all of you will have access to their detailed bios. We have Ankit Modi, who's Chief Product Officer at Cure.ai, working at the intersection of healthcare, Radiology and Technology, Arun Sharma, who's Senior Digital Specialist at the World Bank, and I believe has previously worked as OSD to the IT Minister and on the Direct Benefits Transfer Program. Pragya Mishra, who's lead of the Public Policy and Partnerships for India for OpenAI. Dr. Santosh Mathew, who's country lead for public policy and finance at the Gates Foundation, and has also previously served as a civil servant in India, additional secretary in Bihar, working on teacher education as well as rural development. And Dr. Susan Thomas, last but not least, Dr. Susan Thomas, who's senior research fellow and co-founder of the XKDR Forum, and was also instrumental, I believe, in formulating the IBC, the Insolvency Code in India. With that brief introduction, let me give you all a brief outline of what we're going to try and cover in the next 40 minutes or so. We're going to try and first frame the opportunity for how the Indian government, the Indian state can leverage AI in various functions. We're going to then talk about the human-AI collaboration piece. How can government officials and AI systems collaborate in a way that can enhance, as Abhishek Singh also mentioned earlier, both enhance productivity but also efficiency and efficacy of the government. We'll talk about scaling and trust building, because of course that will be very critical in ensuring that AI systems ensure transparency and accountability and safeguards. And finally, we'll end with hopefully a few minutes on the vision for the future that all the panelists might have here for how AI can be leveraged in building a more capable, more responsive state in India. So with that brief outline, let me start. What I'm going to try and do, given we have a lot of expertise on the panel and we have lots of themes to try and cover, I'm going to pose a question to a particular panelist, but I request that if any of the other panelists have any inputs on that, please either raise your hand, drop me a message, or just put up the hand icon, and I'm happy to then call on you as well. But I'll try and pose one question to one panelist to begin with. So let me start with you, Dr. Thomas. What are, according to you, in your vision, what are the most pressing challenges in India's state capacity that you feel AI is best positioned to address in the near term?
Thank you all for having me here. It's a pleasure. On what is the most pressing challenge in terms of state capability, maybe it's useful to think about organizing what state is supposed to do, right? So where is it that we can think about state capacity being required? And I think of it as two big blocks. One is when the state is performing functions for itself, right? So this is where it is undertaking several activities and how it does its own functions, which is what I think about as the efficiency of the internal working of the government. And there I echo or I cite the Khelkar Shah book, In Service of the Republic, where they say that there are three main functions, which is HR policies, how do you put the right person in the right place at the right time, financing, which is the budgeting, and the last part is procurement, which is something that at XKDR Forum, thanks to Santosh's efforts, we have been working on for the last 4 or 5 years. Procurement is one of the central functions of the government, and in each of these cases, the question that we may need to ask ourselves is, how can AI help in building state capability for the government or for the government officials? The second part of what government does is it interfaces with citizens. And I think that that's a completely different set of capabilities that is required, because dealing with citizens is typically dealing with their queries, their concerns, in terms of the service delivery of that the government gives them. And there AI can be used for in a very different way. And the responsibility of, or the policies that we need to think about when AI is being used for function number one, which is government trying to improve its own efficiency, the efficiency of its internal working, versus when it interfaces with governments has to be two separate things, right? Because the responsibilities and the accountability of both are different. And this is the way that we've been thinking about how AI has to be thought about. It's not one single instrument that can improve the overall efficiency for the government, but there are these two different functions or sets of functions that we must consider when we think about AI. So perhaps this is a hop-off point. I can elaborate further, or if you have hop-off questions from this, perhaps I can elaborate. But if you want me to talk more about these two different types and why I think that they are two different types of functions that we need to focus on when we think about what AI can do for improving the efficiency of the government, I'm happy to do so.
Given limited state capacity, right, that we often hear about, and Abhishek also mentioned, Dr. Thomas, my only follow-up question actually is, of the different functions that you've outlined and categorized into those two buckets, the near-term piece of my question. So which of these would you prioritize more in the near term versus the others?
So my sense is, it's I think about of what can we do as having the bigger bang for the buck. And from that point of view, because we have looked at it from the procurement function, procurement is where government interfaces with private parties to be able to provide services for citizens, right? So this is the interaction or the business transactions that people have with private vendors. These are done in a very structured manner, and what our research shows is that this is a significant part of what the budget of the government is. And efficiencies that you build in public procurement is going to give you a big bang in terms of the growth, because you are able to do three things, right? You're able to deliver those services with greater speed to the citizens at lower cost, means that you are being more efficient on the use of public funds. And of course, people, if the procurement is done well, they're getting the quality of service that they need. So our sense is that in order to be able to think about public procurement, AI is a terrific tool. And in all our conversations across the board with small departments across both the union government as well as state governments, all the way down to the collector level, it is something that people instinctively understand, because it's a contract. There's a procedure involved. And what they need is a combination of what are the laws and the rules and the templates that are required. And if that is created as a base, and AI is a tool that assists the official in terms of being able to do better procurement, it's something that can be very readily played out. I guess the principle of what I think about is a useful tool or a useful place that AI can improve the efficiency of government is to think about AI as being a super efficient assistant to every government official. So I don't think of it as an overlapping layer, but I'm thinking of every single government official, if they can be trained or understand. And my sense is it's very instinctive today, because everyone has a phone, everyone has access to ChatGPT. If it is a case that we can build that knowledge or that awareness that you have a super special or a super intelligent or a super efficient assistant for every government official, then internal functioning of the government can happen quicker. And from that point of view, I also think that we have very clear ideas that we've developed on how we can improve citizen delivery as well. Because the automatic thing that we even heard from the lightning talks was just this, right? That every government official has to deal with multiple voices, multiple languages, and sometimes being lost in translation is one part of the problem, right? You just misunderstand what the person is asking for. And so there are two ways in which I think AI is a very useful tool. Number one, it crosses that language barrier. Number two is the thing that LLMs or AI is born for, which is a classification problem. Very often, an ask from a citizen can be classified as just an information query, right? And that is not something that, say, a collector of a district needs to necessarily bother themselves with. So in a day, if you're getting, say, 25 queries that you need to deal with, if you have an LLM that can just classify which of them are simple information clarifications, then a lower level person can deal with it as compared with your having to deal with it yourself. Or you have the advice coming to you saying that this is just an information query and you can provide it. But there will be what we think about as high discretion, low volume problems as well, where either it's a misdemeanor, they have a complaint because they feel aggrieved by somebody else's action, or there is something that is a service that is not being provided to them. Those are places where the collector or the official will have to spend more time. And AI is not going to solve that problem. But the AI will always be able to, number one, parse all kinds of queries. Number two, classify it in terms of high volume, low discretion questions or information pieces, and then leave the smaller part, which is always the case, a smaller part of the more problematic cases for the district collector to then focus their time on, right? And I think that that is a very simple sounding step, but my sense is that clarifies, for a limited amount of, say, 5 hours in a day, it's then easier for the collector or the government official to focus on the larger problems that the AI will not be able to solve.
Right.
So for both kinds of functions, I think that we have to just think about the AI as playing different roles. And I can't think of prioritization because I think of all of these things as things that we can do immediately. I don't see what the barrier is. We just need to figure out how to do it.
Yeah. Dr. Matthew, let me bring you in. You've of course had a long career as a civil servant yourself. You've cut across boundaries, cut across sectors in your work, both in the government and then since. Tell us from your own personal experience as well, which government functions, and this building on what Dr. Thomas, I think, ended with, that there are certain functions that the AI piece will be able to help triage and all of that, and then certain others that maybe not. What are those functions in your view that could be easily or relatively easily augmented by AI tools, etc.? And which are those that you feel the judgment or the discretion of the human, of the government officer will still remain paramount?
Yeah, thank you. Thank you for the question.
How would you try and distinguish functions?
Yeah, sure. Thank you. And thank you, Artha, for organizing this. So I see this at two levels. One is the internal function of government, and the other is services that government sort of has to deliver. And I endorse everything that Abhishek had to say. So if you look at the internal part of government, one of the fundamental problems is the problem of a square peg in a round hole. Why ending up, posting a horse when you need a donkey or a donkey when you need a horse? I love donkeys. They are much more rugged. They lead no air. But then if you want a faster, running animal, don't go for a donkey. So that's a square peg in a round hole. The second is internally is how do you prepare files for decision making? I mean, I've been a Babu for 32 years, and one of my biggest angst was that the file doesn't come prepared for decision making. What are the relevant rules? What were the past sort of practices? What have been the political promises of the time? All of this is meant to be analyzed, and the options are meant to be posed to you so you can frame it for political decision making. The third is handling of public grievances. Today, unfortunately, most of public grievance redressal is about addressing the grievance and not teasing out patterns that are behind that. Patterns could be around geography, could be around sector, triangulating between vacancies and incompetencies, and all of that. These are three possibilities at government. In terms of services to be provided, I think the classical and the most awaited thing is for leveraging for health. Remember Ken Rao 1963 paper, Uncertainty and the Welfare Economics of Medical Care. I mean, he just showed us how these health markets cannot function. I believe India is going to be the first country in the world which is going to show us a world beyond arrow and why this information asymmetry need not exist. But this will require the ability of the system to take case histories before the clinician and the patient meets. It will require a continuing medical education program that is based on an analysis of electronic health records. And if an analysis of electronic health records have to happen, the electronic health records have to be there. It's not only a question of technology, it's also how do you get clinicians to enter. And there in the last 6 months, I've seen some fabulous movements, best of which is what ECA Care has done, which is that a multilingual conversation between a doctor and a patient in a noisy OPD environment. Multilingual. I put the health secretary of Meghalaya in front of this and asked him to speak on Telugu because he's from Andhra. He serves in Meghalaya, therefore he knows Kasi, and English and Hindi. And believe it or not, 100% accuracy, that conversation was actually extracted and in medical terminology, SNOMED-CT tagged, FHIR compliant, structured data into the electronic health record. Which means at no stage, whether you are undergoing chemotherapy, being dispensed medicine, your medicines, or your X-ray is being taken, or you're having a teleconsult or a face-to-face consult, all of that can actually be captured as structured data. And when you analyze that, you can actually run a continuing medical education program that is based on deviations of standard treatment guidelines, that similar deviations are placed. I do not know how much of people know that in one Harvard study in one state of India, WINIHIP 2022, Comprehensive Health System Assessment of Health Systems, they found that the appropriate treatments according to the standard treatment guidelines was being given to just 2.19% of the population. 97% of the people are getting wrong treatments. We all know about antibiotic resistance. We know about the need for good surveillance. All of this is going to happen in a very seamless way the moment AI is deployed for capturing symptoms and for enabling the clinician patient contact to be recorded as structured data. Finally, it is on education, and that is on personalized adaptive learning. And we know that the biggest problem in personalized adaptive learning, we know the potential. The biggest problem is that the big players are sitting on monopolized access to data, which means they are actually making money out of rents and not because of the quality of analysis and quality of services. So this rent seeking on because you have monopolized access to data has to be somehow tackled. And that's when the education movement can actually move forward. I have much more to say on HR and file movement and public grievance, but I'll rest here because I think at that time you will need to moderate. Thank you.
No, thank you so much, Dr. Matthew. I think there's a lot in there that I would love to unpack more with you. But I'm going to take the healthcare piece that you mentioned and bring in Ankit. Ankit, Dr. Matthew just laid out healthcare and education as two key sectors where AI could be transformative. I know you work at the intersection of healthcare and technology. So talk to us about experience. What does effective, healthcare is also one of those sectors where the public sector and the private sector and startups like yours need to collaborate. So what does effective collaboration between AI systems in the healthcare space, let's say, and government officials and government departments or the public healthcare system look like? And if there are any lessons that you've seen working elsewhere outside of India also, or within India as case studies, would love to know about that as well.
Sure. Thanks, Anirudh. Coming to healthcare, I want to start with sharing two stats, right? One is WHO predicts that there is going to be a shortage of around 11 million health workers by 2030, and it will affect the low and middle income countries disproportionately, right? The second stat, coming to radiology specifically, like India has around one radiologist for every 100,000 people, while say a country like US has one radiologist for 10,000 people. Why I'm sharing this is because assume if you 10x the healthcare budget of a state or a country, we can procure more machines, we can procure more infra, but can we really train 10 million health workers by 2030? Can we really sort of 10x the radiology expertise that is there? So the bottleneck, even with like sort of requisite budgets being there, has been training the human expertise over there. And what we firmly believed is that if you cannot have 10 million new health workers, but 1 million health workers powered with the knowledge base of AI can effectively do the work of those 10 million health workers. So that is something that we have seen internationally in TB screening. For example, Earlier, when you used to take chest X-ray to screen people for TB, it used to take months because you will go to villages, take their X-rays, come back to city, have radiologists read them, and then like sort of go back again with medicines and all. And that used to be a cycle of complete 1 month. Now, because of AI, what I'm seeing across the world happening is that governments are procuring handheld chest X-ray machines, which are going to going door to door to patients who are vulnerable to TB. And these machines are also integrated with AI and they're getting a result then and there. So it's not only improving efficiency of radiology, it has completely opened up a new paradigm only where you can go door to door and do TB screening. You cannot, like, I mean, you can still take a handheld X-ray machine, but you cannot take a radiologist door to door, right? Because we don't have enough radiologists doing that. So that has been a great learning for us to not think of AI as something that will help you do existing stuff better. AI can actually unlock a lot more stuff that is just not happening today. So the to-do space can exponentially grow, and the kind of service and products that you can deliver to the needed part of the population can sort of just expand fruitfully. And that has been our learning. In terms of partnerships, like, I mean, we have worked with governments across the world. We are working with states in India, and like, I mean, the IndiaAI initiative has been very helpful there. What we are saying is that, and I want to just cite Satya Nadella here, who said basically that if AI is that great, why is it not reflected in increasing GDP, right? And that's a very good way of thinking about decluttering the noise around AI, right? I mean, if AI can enable everyone to do so much, we took that argument in healthcare, and what we are telling states and different countries is that somehow, some way, you must be ranking your PHCs, right? And just give us, say, the lowest ranked 5 PSCs. Let us use our solutions to upgrade everything with AI over there. And let me see if those 5 PSCs can actually perform as well or better than the top 5 PSCs that you have. Then we can look at what will happen with the top 5 PSCs if they are also upgraded by AI. And that has been like sort of resonating with governments across the board, and we have been able to convince people to at least try it out and see what's happening. That is bringing a lot of learnings, and those fruitful partnerships between the private companies like ours. And it's not just us. Like, I mean, we have built out a platform where we are encouraging other AI companies to come on board on platform and deliver those digital and AI solutions that we can to this population set. So yeah, I mean, happy to go into more details, but I will hand it over to you, Anirudh. Yeah.
No, thanks so much, Ankit. I think much like Dr. Matthew was also mentioning in the case of Meghalaya and the multilingual work that was able to be done there, it's a lot of about the proof of concepts to be done at small scales that can then prove to be the stepping stone for effective collaboration between AI systems and government departments. It seems to me. Pragya, let me bring you in. Now, at this point, you obviously, I think, will have a view on this, given that OpenAI is also building and helping build infrastructure and policy frameworks around the world for better adoption of AI. So my question for you is that I wanted you to weigh in on is what kind of infrastructure, data frameworks, policy frameworks do you feel are essential for successful AI integration today in government, especially in the context of India? But please feel free to bring in any examples from outside of India also that you feel might be helpful to talk about.
Yeah, no, that's a great question, I think. And thank you for having me. It's been wonderful to hear the earlier panelists. And I think I just want to make, a couple of comments before I go into your question to say, I think all of what has been said is very relevant. And I think the only other piece I feel where there's a lot of work that we can do is also, or our models can do, is really around unstructured to structured data. And I think that's been a massive challenge as we think about, making that transition and really doing all the data and analytics, or really adding the AI layer on whatever currently is being done. And I think we've seen a lot of unlock happen there very, very quickly. Things that would take days are now happening, within hours if you use OpenAI deep research. And we've seen that happening in government context and also in just data sets we've collected off an Excel sheet, which is not really cleaned up. And yet when you see a report on the other side, it kind of makes a lot of sense on what decision you should be taking based on the data that you have. And I think the other thing is also just completely different, paradigm of thinking, which is, I think, often today we think about, I have a particular process and let me just plug AI in and see how it really unlocks efficiency for me. I think often in a lot of these processes, you need to think AI first. And I think that is where a lot of the change management needs to happen as we, want to deploy this both within government and in citizen delivery. Because often I feel, let's say even if I talk about delivering schemes or delivering information, it's like, okay, we have a particular process. I'm just going to follow the same 20 questions. All I'm going to do is have an AI ask it. But the point is, you don't need to go through the 20 questions. You just need to ask one question or ask maybe 4 questions, and you can get all of the answers that you require in order to deliver that service to your end citizen. So I think some of that rethinking is also very, very much required, which we're seeing. And the last piece is really, as we really transition into agentic frameworks, I think a lot of the thinking and analysis will also then translate into action. And so how do we want to think about that, and what is that journey going to look like? And if there are governments and nonprofits and others thinking about that today, I think it's better to build thinking about the agentic framework, because you'll have a much more of an edge when you start to deploy your solutions, than to be thinking in the chatbot world and then realizing, oh my God, like I could have done much more if I was in, really building in the agentic framework early on in the process. So I think those were just some top 3-4 thoughts that I had, in the earlier question. I think on the infra piece, it's an expensive, high investment space, right? And I think IndiaAI Mission has done a fairly, good job in really putting out GPU access and having, many nonprofits come in and build. I at least from what I have been seeing in the last over a year now in India, I think nonprofits are innovating much more than startups and developers, to be honest. They seem to be really at the tip of the spear when it comes to a lot of the AI innovation. I just heard Arman, and like they're doing some incredible work with frontline workers. Similarly, we have Digital Green, who are doing incredible work in the agri space, where they're delivering services to farmers where they're at and on the platforms that they are familiar with, and then doing it in multilingual and also doing it in a multimodal way, right? So I think those things really unlock a lot of opportunity, but also what that means is that you need a lot of the GPUs to serve that near you, and so latency is a challenge. A bunch of other challenges kind of kick in. So we've committed at OpenAI to therefore look at the OpenAI for Countries initiative, because we want to be able to have we're thinking about rolling this out for about 10 countries. We've already signed up UAE as the first. India, I think, is going to be a really important country as we think about that. And that's simply because, the minute you put infrastructure within the country, a lot of the challenges that we face when I have conversations with government around sovereignty or, local data residency or just control over critical infrastructure, that conversation shifts very, very fast. And so we're really wanting to be a partner, a trusted partner to India in its growth, and also in the AI conversations that they want to have, and have a seat on the table when it comes to really driving this forward, and not just being another just consumer of AI, but can you really sort of be at the forefront of a lot of these conversations. So I think infra is a big piece, and we're thinking about how can we invest more, talk about a lot of the large scale public population scale use cases that we want to really think about. I think Susan Thomas spoke about what those could be, and so I think we're working on some of those, but I think it's just going to be a massive collaborative effort when we think about rolling out OpenAI for Countries, with infra being one part of it.
Yeah. No, thanks so much, Pragya. Arun, I want to bring you in now. I know I've kept you waiting for some time, but for those, and I've worked in the IT ministry over a decade ago. This isn't the first big wave, right, of technology. We've in many ways seen multiple waves of technology come. I think the techno optimists in our world, especially out of the big tech hubs like Silicon Valley and Bangalore and others, often tend to sometimes overhype the near-term impact of technologies. And so I always find it very helpful to sometimes keep some perspective and look back into history and look at past waves of technology and see how they played out. And so my question to you actually is around that, right? What lessons can we draw when we think about adoption of AI? What lessons can we draw from previous waves of technology and that technology's adoption in the public sector? To say, okay, these are some of the lessons we learned. And of course, the consumer internet wave comes as the most obvious one, the most recent one. The internet was supposed to have transformed education and healthcare also. But I would argue that it hasn't transformed it as much as it could have. So my question for you is, can you lay out maybe some lessons from the past waves and how that technology got adopted or not in government and certain key public sectors like healthcare and education, and what lessons we can draw from that for today's conversation and adoption of AI?
Thanks, Anirudh, and no worries. I was enjoying listening to everybody, and good to meet some old friends, Sai Pragya, Hi Santosha, and some new ones, Hi Ankit, Hi Susan, and Anirudh. I've enjoyed reading your book, and a pleasure to be here at this panel. It's a loaded question and important one, and I'd just like to give the perspective of where we are today. India is lucky in the sense that what Pragya was mentioning earlier on the infrastructure part, on the compute capacity, we managed to be in a space where we have access to compute. The AI mission is trying to democratize it. It has 34,000 GPUs that are open to the country. But India is one of the 32 countries in the world that have AI compute. There are more than 150 countries that do not have any access to direct access to AI compute. And most of these countries are in Africa and Latin America. In Asia, India and Japan are the only two countries that have this, and apart from China, of course, and the others being EU and the US. Then we have the data sets problem that we have. India sits on a wealth of data across its multiple schemes. And that's my first lesson, since you asked what points we can take, is to invest in change management and not just technology. And we've seen some good examples, starting with the mid-2000s when we had the first National E-Governance Plan, which went into the Digital India 1.0, 2.0, and now we have the commensurate Bharat Broadband Plan. So all of that is enabling India, laying the foundational structures where we can build technology. But it has to go hand in hand with the administrative structures. And I want to point out that the approach that we've taken with the National AI Mission, and this is my personal view, it needs to be elevated at a level where it has a pan-India view. States are not being fully integrated into this paradigm. That's something that we are kind of missing out on, because most of the data that we have comes from states, and though we have the datasets program, it's not gathering the data that is lying in the states. Quality is one thing, but even the sharing of that through the API Setu and all that is not being very functional. So it's a massive change management exercise at a national level. It is a mission, but it has to be a mission in the proper sense, where the entire machinery comes together, and you have to operate at a level which is got a 360 view at the country level, but also understand the granular realities. So what Ankit mentioned earlier, that the least performing 5 PHCs, I mean, the least performing because probably they don't have connectivity. They don't have, so we need to fulfill those. They don't have doctors, they don't have ANMs or ASHAs. We have to have the basics in place, but then at the same time also remember what we are trying to do. So that's one exercise, that one lesson that I think that from learning from the past waves, and we've done it for Aadhaar, we've done it for so many other UPI and the India stack that we talk about. These are good lessons that we have. But to do it for AI is a different ball game. We are in a very, very different turf right now. And it's a challenge that will go with us, remain for some time. The second is whatever we are building, it has to be built as a public good. So we have the foundational stack, but all the other LLMs, so Bhashini was an effort that we undertook, but our national data sharing policy, the NDSAP, which was framed in 2012, that hasn't been updated. I point that out as a major drawback that we have in our, that is, so see, we have the, you also alluded to that point that in healthcare and education, we have sectoral stacks that agencies are trying to deepen and strengthen, but we don't have a cross or sector agnostic data plan that works for everything. So this approach works in some cases, but to be a holistic superpower that we're aiming to be, it has to be a little more than that. My last bit that I'd close with is again focusing on the end user, focusing at the weakest point at the citizen, and keep that in mind on how to design systems and how to take everybody along. I'll stop here. Thanks.
Yeah. No, thanks so much, Arun, for sharing your perspective. I think now Dr. Matthew raised this. I think Pragya, you mentioned it. Arun, you've mentioned it. The connecting piece there that I want to spend a couple of minutes on is data, right? So I think as we've talked about AI, the AI mission in India, computer, of course, has been the primary piece or layer that a lot of people have talked about, spend resources, money on. But I think the data piece is as critical, right? I think, Pragya, you mentioned the ability to take unstructured data and make it more structured. Dr. Matthew, you mentioned how data sometimes is kept by rent-seeking entities in very clear silos. And of course, there's the public digital piece here, Arun, as you also referred to it. So, Pragya, I want to bring you in on that data piece. And there's something, I wrote a Carnegie paper on also about how data is, again, a missing piece in India's AI puzzle. Talk to us about, Pragya, about that piece that you mentioned, the unstructured to structured. So India, of course, is rich in data, right? We are considered to be one of the most data-rich countries. Yet, I don't think that we've reached the level of data consumption for AI models that I think we could. So the question for you is, what is it that companies like yours can do? What is it that governments can do differently to help us leverage our data, not just multilingual data, but also sectoral data from various sectors in order to make that more useful in the AI context? And if any case studies of other countries that have done a great job on this front would be helpful as well.
Oh, absolutely. I'll keep it short because sorry, I have to jump off.
I know you have a
great question. Yeah, sorry about that. I think the one good news is as the models are evolving and getting more and more intelligent, you need to show them less and less data for them to get really smart. So I'll just give you an example. What you needed to, let's say, the amount of data sets we needed for improving Hindi language performance in 3.5, ChatGPT 3.5. Today, for us to do that with 4.0, you need, maybe like 10% or even lesser in terms of the number of hours. And that's because the just models themselves are getting really smart. And so therefore, to come back to your question on if you really want to drive very thoughtful outcomes and earlier to Dr. Matthew's point that I want the file to be ready where I can take a decision, it's more about the local data sets that you need to be able to make to provide so that the models can really learn from it very, very quickly and give you more deterministic outcomes, which is what today everyone expects in the government as opposed to more probabilistic. But if you're looking from a more consumer lens where probabilistic outcomes are fine, then I feel like the models are already doing a very good job. And even in terms of the data collection process itself, I think transcription has been a great use case, where we have seen that happen in courts. We've seen that happen in, with ASHA workers, with frontline workers, where a lot of the problem is that the data is not fed in properly because you're just typing it in. But if you can just do transcription, that whole load gets completely taken away and they can really start to think about the decisions and the real work that they need to do as opposed to the data entry work, which is very repetitive and often very boring and monotonous. And the second thing is also our vision models have improved significantly. So today, if you can take pictures of even handwritten notes or a lot of the files that are there, it converts it into, OCR readable data very, very quickly, and you can start to train your data, train your models on that, or fine tune your models on that. Though it's a little bit expensive, which is why most people prefer to go the other way. But yes, if you have smaller data sets, I think the vision models are really good at doing that. And I think the last, which I said, is, just really, even if you dump unstructured Excels, we've seen with our deep research tool, the outcomes that you're able to receive are great. But then, I think somebody needs to think about that in a concerted fashion and think of it in a more integrated way, as opposed to only thinking about my department and my ministry or my state, but really at a central level, what outcomes can I drive?
Yeah. In the interest of time, I'm gonna try and ask just a couple more quick questions to the panelists, and then for those who have questions for the panelists, please feel free to drop them in the chat box or the Q&A box. Thanks, Pragya. I know you have a hard stop, and otherwise, of course, questions can be answered by the panelists in the chat box also. But the only two questions I want to try and get through before we get to Q&A is one, and this I'll come back to Dr. Matthew, to you, and Dr. Thomas, to you on, if you both have views on this, is what role can philanthropy and academia play, right, in supporting more sustainable and responsible AI adoption for state capacity? Right now, Dr. Matthew, of course, now wearing your latest hat, maybe you could talk to us about how philanthropy and non-governmental organizations can help the state in adopting AI much more responsibly and much more scalably.
Who should go first, Susan or me?
You can go first, and then we'll maybe bring Dr. Thomas in as well.
Okay. So today the problem is frankly not of technological capability. According to me, the problem is imagination. We have a world in which the senior leadership has grown up in an analog world, and they are unable to imagine what a digital world looks like. I'm just look at the very basic change that has happened. Tech has been able to disintermediate between worker, and workplace. Work, worker, and workplace. People cannot imagine how to do this again. I mean, when I was in government, just to demonstrate, I took my laptop from my office in Krishi Bhavan in Delhi and took a metro to Gurgaon. And I carried some of my people from my ministry with me and said, listen, I'm going to be in this metro and I'm going to dispose my files. I am the worker. My workplace is in Krishi Bhavan. I'm disposing of files sitting in a metro train. People cannot imagine that you can actually run a continuing medical education program when one doctor is sitting on a Goa beach and the other is meditating on the Himalayas, the third is sitting in Apollo Hospital, in its restroom. But this will become efficacious only when people are nominated to the continuing medical education program, not that people sign up. And how is nomination to be done? This nomination is to be done on the basis of similar kinds of deviations. So let us say a 3-month-old baby is being prescribed third generation antibiotic for 1 day of loose motion. That's not indicated in the standard treatment guidelines. But if you have 12 doctors in a state who have actually done that, it is these doctors who will be nominated into a CME presided over by the state's foremost pediatric diarrhea management doctor, where they will discuss the insights of the case. And probably they will conclude in certain exceptions, the standard treatment guideline needs to be changed. The point that I'm making is that this imagination is what is the problem today. So the role of philanthropy, according to me, is to actually produce that new imagination, spend the financial and convening resources to be able to demonstrate it in a geography so that others can see what the possibilities are, or just just destroyed because it is not working. But these experimental sites that actually harvest the full power of a new imagination is really what, according to me, is lacking, and that can be the role of philanthropists. But the problem is, most philanthropists want results yesterday. They want evidence of impact. They want to be able to tell the world that my $1 actually produced a 100x impact. So it's just not philanthropy. We need patient philanthropy that understands why some of the lateral sort of transversal issues in state capacity need to be solved for. And the problem is not that the state does not have the capacity to solve for them. The problem is the way our state is structured. Elections once in 5 years, ministers changing portfolios, I don't know, as often as is possible, then bureaucratic changes, then procurement problems. Susan said about procurement problems. Her research will tell you that some of the tender notices were on an average changed 20 times before it was done. And some tenders don't even see the light of day in years to come. And then leave alone, tenders, leave alone the other problem is that who wants to engage with government, not because there is a rent-seeking problem, but because there's uncertainty on when the decision will happen. There's uncertainty on when the payment will come. So all of this is actually interlinked. And therefore, we need to take use cases that are sectorally focused, that have, it was my, when I was in the National Council for Teacher Education, I was reporting to the Secretary of School Education, Mr. Anil Swarup. I think he was so wise when he said it is the intersection between political salience, administrative feasibility, technical appropriateness, and financial viability. That's where the magic will happen. Philanthropy has a role to demonstrate that magic.
Yeah. Quick 30-second intervention, Dr. Thomas. And then I have a couple of questions I'll try and bring in from
Since Santosh has dealt with the philanthropy, I'll try to take a shot at the the role of academia, where I want to bring us back to the fact that we are thinking about AI for state capability, right? So this is state, which is the combination of executive, legislative, and the judiciary, and very often they are busy doing their job. And when there is a fire that comes up, their response is to just put it out. However, if you want, very often, especially in a growing country like India, which is growing at 6% or has been growing at 6%, we do need more structural analysis of what is going wrong. And that is only something that someone who sits on the outside can do, right? So there needs to be deep research that asks, okay, we've seen this problem happening. How frequently has this happened? And it's not just a problem with people not understanding what the information is, right? So as I said, when you have, and I think Santosh and Abhishek brought this up, that there is this role of the interface between state and citizen. And so when a customer comes up or a citizen comes up with a complaint, we need to understand what is the source. Very often it can be dealt with a simple information clarification, but when it doesn't, there needs to be some time that's taken to analyze the problem. State does not have the time or the capability to do that. And that's perhaps not what they should be doing. However, this is where the role of academia and more broadly civil society has to come in, that they can identify the problems that are not purely information clarification, but there's something structurally going wrong, either in terms of poor laws, or there is a structural market failure which is missing laws and regulation, and come up with alternative solutions that can fit with our problems right now. So I don't know whether AI can play a role in this, but certainly AI can help the academia or civil society come up with an analysis faster. But this does require for state to open up and become a little more transparent in terms of things like how much is the customer grievance, or citizen grievance and complaints, and that kind of analysis and data. If it's open up to academia, civil society, my sense is AI can be a terrific assistant to be able to come up with an analysis and solutions quicker than we have the ability to do it if it was just sitting with state.
Yeah. And of course, think tanks like Artha, and of course consulting firms like Dalberg, I think also have a big role to play in both sparking that imagination.
They're all part of what we think of as civil society, right? So philanthropists, let's see, academia, it's research organizations like all of us on this table, and the consultancies. But it is required to have this kind of a body of people in a country who should be dealing with, okay, so what is the problem, what drives it, and what are the solutions?
Yeah, yeah. So I know we've run massively beyond our time. So I'm just, if Sridhar, it's okay, I'm just going to take one question from the audience. In fact, a couple I'll combine and pose it to you, to the panelists. Ankit and Arun, if you have thoughts on that, please take the first priority on that. Otherwise, we'll bring in Dr. Matthew or Dr. Thomas as well. So the question is actually the audience seems to want to ask two questions, right? So one is, are there certain challenges at public-private partnerships? The point that Dr. Thomas was also making, the government will have to open up if it wants assistance. Ankit, Arun, are there certain challenges or obstacles, hurdles that today public-private partnerships in this context, the AI context, exist that you think need to be overcome? And related to that question is the question on data sharing, right? I think that's one piece of it, which is, why is there still such difficulty and reluctance in data sharing, both within government departments, but also by the government to the non-government sectors? And how can that be overcome? So I'll give both of you the floor for about a minute each to solve this big problem for us.
No, I think from a public-private partnership point of view, there are issues from both ends that can be done better. I would say, like from a government point of view, we need to be more judicious of how we are selecting AI that gets actually deployed, right? Like, I mean, we are basically, I mean, if we're looking at diagnostics or like sort of therapeutic AI, we should be judging on scientific evidence, what is the body of work that the company has produced. And that would go a long way in terms of creating that understanding, like how to judge an AI company. From our end, I think most of the AI companies can do better in terms of how they bring AI solutions to the actual users, in the sense that, I mean, it may be AI, but the end user need not know that it's AI if it's useful. Simple technologies like sort of work very simple to understand technology scale very fast. I mean, look at, for example, SMS, such a simple tech, such a huge impact through direct benefit transfers. And that is how, like, I mean, you have to deliver like sort of AI in a very non-intrusive, seamless manner, which is easy then for the health workers to adopt, and then they can also recommend that, okay, this is useful, and the government's decisions also become very easy to encourage adoption for such tools. So that's my 2 cents on this.
Great. Arun, you have the last word.
Thanks. And I think you already answered it. In my experience, what I've seen is getting access to data for the private sector. They have good ideas. There are sandboxes that are being tried out in several states. And the biggest concern or the biggest advantage through these sandboxes is that the government is able to provide good data sets to the problem-solving infrastructure that's been put together. And once that is solved, the next step for scaling it up, we have good solutions. We saw a couple of them right here. So there are numerous such examples that exist. So one, there is no good repository of these solutions. And then the scale of these, how do you scale it up at a national level or even at a state level? So if we have, so first is, it's a larger problem that I mentioned earlier on data sharing, and it's legal come technical. But once we have a good solution, how do you actually scale it up? How does the government own it and take it forward is something we're yet to see in the public space.
No, thanks so much, Arun. I think I'll just end with a very brief point, which is that I think as we've all heard, there's lots of opportunities, there's lots of structured thinking that go into making our governments adopt AI and build that state capacity up in various functions. But I think at the same time, much like I think how Arun's last intervention was, there's still a lot of questions around scaling it, capacity building for the government officers, and of course there's an ecosystem that needs to be built around the government to help it. in this case. With that, I thank all our panelists. Thank you so much. I think if we were in person, we'd be applauding you clearly, but thank you so much for all your inputs and suggestions. And with that, let me hand it back to Sridhar.
Pleasure.
Thank you.
I know we're 20 minutes over time and we were only able to get to a selection of the questions posed, but still grateful to have 100+ participants still continuing to engage on this topic. On behalf of Artha Global, Dalberg, and Tech4Dev, I'd like to thank our speakers and panelists today for sharing their experiences and perspectives, and for the provocations and ideas they've left us with. And of course, the wonderful audience for engaging on this topic and your valuable contributions today. We do plan to build on this conversation and explore areas we can collaborate on. So please feel free to reach out to us. We will keep you updated on future opportunities and events. Thank you all for joining us. Have a great day.